All right, so there have been some major shakeups for the country's public health department this past month. Robert F. Kennedy Jr. officially fired CDC Director Susan Menarez last week.
Her dismissal, along with a rollout of new vaccine policies, led to over 1,000 HHS staffers to call on RFK Jr. to resign and multiple top officials at the CDC to step down. This morning, we're speaking with one of those officials, Dr. Dimitri Daskalakis. Thank you so much for being here. You were director of the CDC's National Center for Immunization and Respiratory Diseases before resigning. Thanks so much again.
Good morning. Thank you so much for having me.
So, we heard from Senator Raphael Warnock, who called RFK a hazard to the health of the American people. But you were among those yesterday really doubling down on the fact that RFK, you said, was lying throughout this thing about COVID, about the CDC firings. And I'm wondering how consequential you think this was and what people walked away with at the end of it.
I'm really sad that public health has become so politicized in a debate. So I'm going to just start by saying, I think that finding common ground is really what needs to be, the guiding principle, the North Star for making sure that we protect the health of Americans. With that said, I think when you're seeing a health secretary who is not actually telling the truth, who is saying that COVID vaccines, as an example, are dangerous, the most dangerous vaccine known to people, and that it didn't do anything to end the pandemic, I think you need to sort of zoom out. It did help end the pandemic. Nothing is perfect. I think that the legacy of the Trump administration in terms of Operation Warp Speed is being denigrated by the words that Secretary Kennedy says. And as a public health person, I think it's one of the miracles of public health, the work that happened there. And so, I just look at this and say, we need to sort of end this and get to a place where we have leadership that wants to work with versus against public health.
Point. Let's play some sound from Senator Bill Cassidy of Louisiana, who is a doctor himself, talking about Operation Warp Speed.
Mr. Secretary, do you agree with me that the president deserves a Nobel Prize for Operation Warp Speed?
Yeah, absolutely, Senator. That was phenomenal.
So let me ask you. But you just told Senator Bennett that the COVID vaccine killed more people than COVID.
Wait,
that was a statement.
I did not say that.
Okay, then let me ask, because you also
Senator, I just want to make clear, I did not say that.
We'll check.
So, Doctor, what worries you the most? Is it the vaccine sort of upheaval that's going on with this advisory committee? Is it the fact that this has now sort of created a two-tier system of health at the federal level, and then states banding together to sort of create their own health agencies to get, vaccines out there? Or is it just the sheer number of folks who have been let go at the CDC and the impacts it'll have on America's health?
Yeah, so the common denominator there is that the thing that worries me the most is things that are compromising the health of Americans. The list that you made, I think, is fairly good. There is clear activity that's happening at HHS and CDC that has already limited access to vaccines. Limiting access doesn't mean increasing freedom. It's the opposite. So what you're seeing is by limiting access, people aren't able to make choices. And that is, I think, highly problematic. The second piece is this isn't just about the health of the kids and the health of older adults. It's about national security. And so I think that not only is this compromising our health every day, but it's creating holes in a system that exists to protect our national health security. When the next big thing comes, which it will, we are not prepared. And we are less prepared now than we were before Secretary Kennedy took the helm. So that makes me very concerned. I worry for everyone's everyday health, and I worry about the national security of our country from the perspective of public health.
So a bunch of Western states are getting together. They want to kind of create their own thing to keep their people healthy. Governor Kathy Hochul in New York wants to put out an executive order so that pharmacists can prescribe and deliver vaccines. If we have this bifurcated country where some states have their own sort of healthcare systems or rules, if you will, and recommendations for the CDC are something else, is that a legal fight, or can states just go ahead and do it? Do you have any idea?
Yeah, it's such an insightful question. So first, I think states are able to make policies on their own. There may be some limits in what they're able to do. There may be some impact on on coverage in other sort of insurance systems that they don't potentially have dominion over. But I think ultimately, I think the main part of your question that is really important is what's happening is the decentralization of guidance and public health in the US. And so what you're going to see is well-resourced states, and I think California and New York are examples of well-resourced states, will be able to go at it on their own to really protect their population. And then states that don't have those same resources, given that they won't have the support and the good guidance from CDC, and frankly, also the money that makes sure that there's staff on the ground in those health departments in those states. What that's going to mean is that there will be a tiered system. There will be have and have nots from the perspective of health, which is not really at all an American vision. Granted, our system is fractionated. Health is not perfect in America, but systems exist to try to improve that disparity. And this, I think, is making it deeper. And so I think it's exactly what you said. You've hit the nail on the head.
Dr. Daskalakis, I want to read from your resignation letter. You wrote, "I am unable to serve in an environment that treats CDC as a tool to generate policies and materials that do not reflect scientific reality and are designed to hurt rather to improve the public's health." Just talk about that decision to resign, because some folks might say, look, if these are the folks who are there to sort of serve as guardrails against what Health Secretary RFK Jr. is trying to do, why leave? Why not stay in the fight?
Yeah, it's hard to be a guardrail when the train is off the tracks. So that, I think, is probably an important thing to say. I am a physician, and the first part of being a physician is taking the Hippocratic Oath. And that oath begins with first do no harm. And so when I'm seeing that scientists aren't able to help provide disimpassioned data to help really guide policymakers into policy, and what I'm seeing instead is that policymakers have made decisions and are retrofitting the data. So they're making the data fit the decision rather than having the data allow them to make a better decision. So when I see that, that's harm. There have been warning signs the entire time over the last 7 to 8 months. But with the dissolution of the Advisory Committee on Immunization Practices, with documents that have changed that committee into really a ideology machine, I didn't see that there was a way to do anything but harm as long as I stayed. I've got to say, the scientists who are still at CDC, they're dedicated, and they're going, I think, to continue to present disimpassioned data. The question is, will the American people be able to see it? Will it be posted, or will it be taken down the way it was last time at the ACIP meeting because it didn't correlate to the ideology of the secretary? So this is my red flag. The science is still going to come out, but is anyone going to be able to see it if no one lets it come out? Or if someone really, if the ACIP committee decides to undermine the data systems and the data and say, well, we don't like the science, and then decide to sort of make it unstable so that Americans really don't know where to go. It's being agents of chaos. And I feel like chaos means inaction, and inaction is going to mean really bad health outcomes.
I've got to ask you one question. There are a lot of people who reject the notion that vaccines are safe and effective. They also reject the notion that people should have to take them. So should they have the right to reject vaccines? And if not, what would you like them to consider?
Yeah. So first, we listened to the American people at CDC. We did formative research. One of the things that we had been doing on the websites and other information coming out of the immunization center was we heard that Americans don't like absolutes. They don't want to hear the word safe and effective because it sounds so absolute. And so the messaging and the strategy already shifted in saying, let's talk about the risk-benefit ratio. Like, what's the risk of the vaccine versus the benefit, so people can make their own decisions. Last season, there was no campaign that said vaccines are safe and effective. What the campaign said was risk less, do more. And so we heard the American people and already shifted the messaging. So I also believe that people need to be able to be free to decide whether or not they want to vaccinate their kids or not. By RFK Jr. removing access to vaccines, there's no choice for some people. They won't be able to get it, so they can't make a decision. That is what the American people need to know. These policy movements matter because they mean that a vaccine may not be available to you or your loved one. Like we already heard, I think Senator Cassidy talked about someone in Georgia, where I live, who had stage 4 cancer who couldn't get vaccine. That means no access. So where's the choice?
All right, Dr. Dimitri Daskalakis, former director of the CDC's National Center for Immunization and Respiratory Illnesses. Thank you so much for being here this morning.
Thank you.
We appreciate it. Let's continue the conversation now and get back to that contentious hearing that was yesterday. Drew Petromero is joining us. Drew, what did you make of the conversation we just had with the doctor, and how really the hearing yesterday just sort of he points to as, see, I told you so. This is what we're dealing with.
Yeah, you know, these concerns that about Kennedy's leadership have been boiling for many months and kind of boiled over during this hearing yesterday. And what the doctor said was echoed by many members of the committee during that hearing, and even some Republicans, which is kind of the more interesting part here. We often hear Democrats criticize members of the Trump administration, but to have Republicans coming out so forcefully against Kennedy was kind of remarkable yesterday. After the hearing, Senator Cassidy, who was the key vote that allowed Kennedy to get approved to his position, declined to say whether or not he still had confidence in Kennedy serving in the role, and said that the Senate would continue to investigate accusations of politicization.
So Cassidy was one of the physicians on the panel yesterday. The other was Senator John Barrasso, and here's what he had to say.
Secretary Kennedy, in your confirmation hearings, you promised to uphold the highest standards for vaccines. Since then, I've grown deeply concerned. The public has seen measles outbreaks, leadership in the National Institute of Health questioning the use of mRNA vaccines, the recently confirmed director of Centers for Disease Control and Prevention fired. Americans don't know who to rely on.
And not just that, there were a lot of people in that hearing yesterday, a lot of senators who were like, listen, this was bait and switch. We asked you about this stuff before you were confirmed, and you sold us a different bill of goods, in their opinion.
Yeah, and Barrasso's criticism is notable there. He's a member of Senate Republican leadership, seen as a close ally of the White House. For him to come out, especially if you look at his written remarks, what he knew he was going into this hearing to say is pretty stark criticism of Kennedy. So it'll be interesting to see moving forward where that criticism goes. It should be noted, though, coming out of the hearing, the White House praised Kennedy's performance, and Trump himself has been a critic of vaccines and expressed criticism of the dangers that he believes of vaccines going back more than a decade.
So we've heard from multiple Republicans during this conversation. Let's listen to Virginia Senator Mark Warner about what his takeaways were from this hearing.
The takeaway I had from my exchange was you've got a Secretary of Health and Human Services, 8 months into his job, that doesn't know how many people Americans died from COVID. You've got a Secretary of Health and Human Services that want to give Donald Trump a Nobel Prize for Operation Warp Speed, but won't acknowledge that the mRNA, the vaccine, saved American lives.
And so that's sort of the knots that Kennedy appeared to have tied himself into while trying to answer these questions, saying things like, well, I don't know, I haven't looked at the science. And you've got these senators saying, you've been in this job for many, many months now, why haven't you?
But really, he was pretty combative during the hearing, and that's something that I think the White House wanted to see. And I think from a White House perspective, they think that Kennedy held his own during that hearing. That issue about the mRNA research is also a very interesting one. One of the things that have angered senators is this cancellation of $500 million in grants that was used to study mRNA. This is the foundation of what was used to create the COVID vaccines, but also it's seen as something that's going to be very crucial in the prospects of having another pandemic, that being able to quickly develop a large number of vaccines, the mRNA technology is seen as the best way forward to do that. And if that research is curtailed, it will take longer to develop a vaccine in an emergency, and eventually, the worry is that would lead to more death.
All righty, Drew, thanks so much. Really appreciate it.